Welcome back to another episode. In this video, we're talking about progesterone and how it's used in hormone replacement therapy, its benefits, everything else. And so if you missed the previous episode on estrogen, view that right here. My name is Eric Schmidt. I'm board certified OBGYN, minimally invasive gynecologic surgeon. Let's once again try and make the menopause transition even better. And so let's talk about progesterone therapy. Progesterone has its uses. Not everyone actually takes progesterone for hormone replacement therapy. And why is there a big difference there? Now, progesterone is one of the female hormones. It's made by the ovaries and during a specific part of the menstrual cycle. It's also secreted by the placenta during pregnancy. Just a fun fact. During a normal menstrual cycle, progesterone rises after ovulation, helps stabilize the endometrial lining that it's built up, and then when it's withdrawn, if pregnancy doesn't happen, and the corpus luteum starts to dissolve, then that withdrawal of the progesterone causes menses. Okay, and this is good and healthy for the uterus to go through this process. If there's too much of an estrogen-only signal, it can potentially put someone at a little bit increased risk for developing abnormalities like hyperplasia or precancerous changes, or potentially worse if it's gone unchecked. And so that's why we'll talk about if someone is experiencing perimenopausal type symptoms, progesterone has its main benefit in protecting the uterus. And a little bit of spoiler, that's the traditional book answer, but maybe it even has more benefits beyond that. So again, let's talk about the different types. So your body produces progesterone. However, to make this commercially available was difficult. It was hard to make it shelf stable and get appropriately digested by the body's system in a pill to take progesterone. And so they were developed what's called progestins in the 1950s. This is when progestins were first developed. You might recognize names like Provera or so Provera is medroxyprogesterone, and then there's norethindrone, and then there's a number of different megesterol. There's a number of different progesterones that were synthetically developed. These are a little more potent. They have a stronger response in the body than the normal progesterone, but they do help a lot of people to this day with issues like bleeding. And prior to 1998, when Prometrium was first to market, where they were able to micronize these progesterone molecules, make them stable, make them useful in a tablet or to be placed vaginally, we started to use more progesterone. However, there was also something that happened soon after that. It was called I'm going to do a different color. It deserves a different color. WHO, early 2000s, this study came out. Progesterone use at that time was mainly these progestins, okay? Because for a study, it was the years prior to that, and the only thing available was things like Provera, norethindrone, which have a more potent effect, which potentially increases someone's risks a little bit of certain things. We talked about risks of hormone therapy in a different video, but this WHO study came out, and it kind of decreased the prescription of things like Prometrium. I'm sitting here editing the video, and I'm realizing that I had a brain fart, and I didn't finish my thought. So what I was trying to say is that the WHO study looked at the potential side effects of hormone therapy, and it scared a lot of people away from using hormones because of the potential increased risk of things like blood clots, strokes, things like that. But that was only in certain populations when they reevaluated the study. And so what it did is it hurt a lot of prescriptions for a lot of people that needed this hormone replacement in their perimenopausal time, when a lot of the risks were in the 60, 65 plus range. And so the study really only included the progestins, which were the synthetic kinds. The progesterones, which were the Prometrium, really weren't even developed yet, or definitely weren't studied in this study. So it decreased the prescription of a lot of these progesterones, the Prometriums, the ones that are tolerated better, for the decades to follow. And we're still kind of recovering from that study in the prescription from a lot of the docs now that are went in through their training and practicing. They decreased their prescription of a lot of the hormone therapy because they were scared because of the study. And so we're still recovering from that. And that's what I was trying to say in this, is that we learned that the prometriums are well, or the progesterones, which is prometrium, which is bioidentical, is generally well tolerated for the most part, and might not have these same or increased risks that the progestins in some age groups may have. All right, back to the video. And so we found out that actually taking this progesterone is probably the ideal situation. These are the bioidentical option, is progesterone or prometrium. Progestins are more of the synthetic option because these are more similar to the body, potentially a little less potent. There's less side effects. The progestins, synthetically made, the body has an increased response. They're a little more potent. This is why someone with these progesterone medications might have a little more side effects with these medications. So often when somebody's coming in with perimenopause type symptoms, these are symptoms like hot flashes, these are symptoms like brain fog, these are symptoms like metabolic changes. There's a number of different symptoms of menopause. We have a separate video on it. But if someone's coming in with these and they want help with these symptoms, the main thing that's going to help with these symptoms is estrogen and the estrogen patch or pill. However, if someone is just taking estrogen, we talked about too much of an estrogen signal without progesterone puts the uterus at risk. So these progesterones protect the uterus. This is the book answer. This is the main reason why traditionally we've used progesterones for hormone replacement therapy, is to protect the uterus, decreasing the chance of hyperplasia or endometrial cancer. And this is what I learned. This is what we were taught. However, again, this area of medicine is relatively new, and we're learning that they might actually have even more benefit, especially when it comes to sleep. And so if I'm prescribing progesterone for my patients, especially the prometrium, I recommend taking it at night. It helps with sleep, helps with racing thoughts, maybe even a little bit of those anxious thoughts, racing thoughts at night. Progesterone has been shown to potentially have these benefits. But if somebody has a hysterectomy and they desire hormone replacement for the symptoms that they come in with, they don't have to take progesterone. Estrogen is going to give them the main benefit for a lot of their symptoms. However, it's not wrong to say, okay, the estrogen's helping, but maybe can I do, it's not quite the difficulty with sleep, the difficulty with racing thoughts and anxiety at night. Progesterone might help with that. And so it's an option to talk to your doctor and see if they'd be willing to prescribe you a progesterone to go along with it. Talking about the side effects of progesterones a little bit. Now, actually, I would say that the side effects are much lower than that of what we see potentially with some of the estrogens, but it is a hormone. It does potentially cause things like bloating, mood swings, potentially like headache or even breast tenderness. And so there is a long list of potential options. Overall, the risk of things like blood clots and things like that, which are the scary things, generally we attribute that a little bit more to the estrogen therapies. Progesterones are generally tolerated really well, especially the bioidentical ones. And so side effect profile is generally pretty good. And how can they be taken? They can be taken kind of just like estrogen. Mainly we'd use it as a pill form. Again, this can be done orally or vaginally. And there is a patch which has combination of estrogen and progesterone, the combi patch. There's I think one other brand name out there for that. And so those are the two main ways that progesterone can be taken. As always, if you made it this far, little like button right there, follow along, send it to somebody who you think might need it. We're likely talking about testosterone in the next video if I were to make a guess, so stay tuned.